Welcome to the U.S. Adolescent Mental Health Dashboard, which is the newest edition of the Girl Center's Adolescent Atlas for Action, or A3. It's the first ever A3 dashboard that uses U.S. data, presents national and state-level data on reported depression amongst high school students in the U.S., along with key demographic patterns and social and structural determinants. In this walkthrough, we'll explore each section of the dashboard and show how to interpret maps, charts, and scatter plots to draw meaningful insights. This section provides a national overview of adolescent depression rates across all U.S. states. Each state is shaded to show the prevalence of depressive symptoms, allowing you to quickly identify geographic patterns and regional clusters. Hover over a state for totals. Next to the map, the bar chart ranks states from lowest to highest prevalence. Clicking on a bar shows all states at the same level of depression. Use this view to compare states, spot outliers, and recognize broad national trends. In this section, you can also explore depression estimates by racial and ethnic groups. Selecting a group updates the map to display state-level differences within each group, highlighting disparities that may not be visible in aggregate data. Click on a state to review deeper details, including depression prevalence among different racial and ethnic groups, and also by gender, helping you understand where disparities are most pronounced. This view also allows the ranking of that state compared to others and allows you to navigate between states. This section shows the national overview of reported depression by gender for males and females, using available data, which focuses on those students who identify as male or female in the survey. The adjacent bar chart shows the range for females and males to allow comparison between states. As with the above map, you can hover over the state for the specific depression prevalence by gender. This section visualizes depression rates by gender using a scatter plot for a quick comparison between genders. Each point represents a state with male prevalence on the x-axis and female prevalence on the y-axis. This helps you to see whether rates are similar across gender or if one experiences much higher reported depression rates than the other. To note, more female depression across all the states. You can also adjust the size of the axis for a more detailed view. The determinants page provides a different type of information. So to reach it, you go back to the menu and click on social and structural determinants. In this page, you can see the layering of two variables within the national and state level maps. It introduces social and behavioral factors linked to adolescent mental health, including both health system and behavioral influences. Here, there's a summary of the three key determinants included: physical inactivity, health insurance coverage, and the availability of mental health providers. Each of them is presented alongside reported depression, preparing you for the detailed maps and scatter plots in the next section. I'll walk you through the three maps. The first map displays the relationship between physical inactivity amongst adolescents and depression rates at the state level. Use this map to explore whether states with higher inactivity also report higher depression prevalence. States are shaded according to levels of physical inactivity and depression. Darker shades indicate higher levels of physical inactivity and depression. You can hover over a state to see the specific levels and how they compare to other states, as well as hovering over a section of the legend to see the states in that category. For instance, 7 states have the highest level of physical inactivity and depression, while 2 states have the lowest levels. You can also explore this information using a scatter plot. The position of the states on the scatter plot again reflects the level of physical inactivity along the horizontal axis and depression along the vertical axis, which aligns to the legend on the right. Each point represents a state, and again, you can hover over each state for details. The second map highlights the percentage of children 0 to 18 years old who lack health insurance and high schoolers' level of depression. Comparing these outcomes allows you to explore whether lower insurance coverage aligns with higher mental health concerns. As with the previous map, darker shades indicate a larger problem. And again, state level details are available by hovering over a state. The scatter plot on the right compares depression prevalence with rates of uninsured children, again 0 to 18. This different view is a way to explore the levels of these outcomes and their relationship. Outlier states may reflect, for example, structural differences like Medicaid access, private insurance coverage, or local policy environment. The third map portrays the ratio of the state's population to mental health providers, that is, the number of individuals served by one mental health provider in a state, if providers were equally distributed across the population. This can be compared to high schoolers' levels of depression. Darker shading indicates lower provider availability and more mental health problems, enabling users to identify states where provider shortages coincide with higher mental health needs. The scatter plot on the right shows each state plotted by its mental health provider availability and depression prevalence, again aligning with the legend, which shows provider availability on the horizontal axis and depression on the vertical axis. Examining this graph can help identify states where service capacity may be insufficient for adolescent mental health needs.
The last tab in our dashboard presents our methodology. It describes our data sources and analytical methods used throughout the dashboard. It also outlines key limitations, including variation in survey years, sample size constraints, and the reliance on self-reported mental health symptoms. It also notes that certain states did not report on the depression variable in the year 2021. These limitations are important to consider when interpreting results or comparing states.
We hope the U.S. Adolescent Mental Health Dashboard is a useful tool to support researchers, practitioners, and policymakers who work to improve adolescent well-being across the country and at state level. Please explore, analyze, and share the tool and the insights it inspires. Thanks.